I urge all of our nation's governors to ensure that the massive deliveries that we've made to your states over the past few weeks are distributed as quickly as possible. So again, we're working very well with the governors. Now, they may see you and say, oh, we're not happy, but they're very happy on the phone. And Mike Pence is a straight shooter, and he had a great phone conversation to them with all of the governors, teleconference. And they're very happy, every one of them. Were there any negatives? No, sir. See? I told you.
Well, the president is saying that none of the governors have any complaints. Well, the fact of the matter is that New York says that it needs 40,000 ventilators, and it only got 4,400 from the federal government. It says that it has had more success in securing ventilators from China and from Oregon. Louisiana has requested 14,000 ventilators and has only gotten a few hundred. And Illinois has requested 4,000 ventilators. The last numbers I have, it has only gotten 450. New Jersey requested 2,500 and got 850. Virginia requested 350 and didn't get any. Furthermore, the New York Times reports that thousands of the ventilators that have been sent out by the federal government have turned out to be broken.
So JVL, let's talk about the numbers, what we're looking at in terms of the models, the trend lines. You had a really alarming piece the other day. There are the truthers out there, of course, who are insisting that all of this is being exaggerated, that there are not as many deaths. I think the evidence would suggest that there are more deaths from the coronavirus than have actually been reported. The president and others are saying that there's some evidence that maybe we are flattening the curve. What are you seeing? Because you've been watching this very closely.
Yeah, there is some evidence that the curve is beginning to flatten, which is good. The University of Washington's model has been revised down they pulled 12,000 deaths off of their median variance scenario, which is good. To give you some sense of scale, so exactly 1 week ago today, we went over the 3,000 death mark. Those are the official deaths. At some point today, probably early afternoon, we will go over the 10,000 death mark. So that's a 333% increase in 7 days. The good news about that is that the doubling rate itself is slowing a little bit. We had been doubling every 4 days. Now the doubling is close to every 5 days. So what we're looking at is you're looking for the rate of increase to slow, right? You're still increasing. But the rate starts slowing. Your DXDT changes a little bit. The problem in all of this, though, and I've been, the New York Times ran a deep dive on this weekend, which I was happy about because I've been ringing this bell for weeks now, is that we believe, based on anecdotal reports from doctors and public health officials, that the true number of coronavirus deaths is much higher than the recorded number. And that's because we still don't have an availability of tests. And so people who are admitted to the hospital who are very symptomatic may not be tested to begin with because the doctors feel like they don't need a test. They know the person has it. And then if that person dies, they don't have the time or the ability to do postmortem testing. And so if there isn't a positive test attached to a death, the death is not counted as a coronavirus related death. And anyway, so you've seen the Wall Street Journal had a deep dive on this in Italy last week, where in Italy, it looks like the true number of coronavirus deaths in some towns might be 2 or 3 times the number of officials.
2 or 3 times.
Yeah.
This is much. We're not saying you're off by 50%. You're saying you're off by 200 to 300%.
Yeah. So, but there's no way of knowing. So what the journal looked at was they looked at Bergamo, Italy, and there they took the total number of deaths in March of 2019 and compared it to the total number of deaths in 2020, and it was like a 4x. But on the other hand, only one of those multiples was officially ascribed to coronavirus, and so so what happened here? And there's no way of knowing. Now, somebody will at some point in the after action report here do a very deep dive statistically. They'll look through the listed cause of death and anybody of a certain age will be whose deaths are attributed to like respiratory failure, but not to COVID-19. They will sort of run regression analyses and figure out exactly what's going on and come up with some sort of model. But the reason we care right now, the reason I bring this all up is that it's not academic, because if you don't know the total number of true deaths, then you can't actually know whether or not your rate is decreasing or not now.